Hello everyone and welcome back to the 2015 Health Technology Conference. I hope everyone enjoyed that dance. It woke me up for sure, so that was fun. I will be your MC for this track for today. My name is Ashley Hunt. I'm the founder of Infinite Strength, a fitness company that sponsors community outreach programs for children of sexual violence and abuse in San Francisco and in East Bay. I will be introducing our first panel today on data security and privacy. A little bit of a description of what their panel will be including. There are hundreds of cool mobile apps developed for healthcare and social services every day via hackathons, startups, and leading corporations who knows where. But what about the millions of pieces of personal data handled along with it? What are the potential pitfalls to grassroots developments? What's happening to the data? Where does it go? And how safe is it? As a developer or a consumer, are you considering all the risks? I would like to now introduce our moderators, Scott Lovell, attorney and professor, and also partner at Hogan Lovells attorney.
Great, thank you, Ashley. So again, my name is Scott Laughlin. I'm a partner at Hogan Lovells in Washington, D.C. My practice is focused on privacy and cybersecurity, and so although I'm based in DC, I represent a number of the technology companies here in the Valley and in the entire region, both kind of at all different levels of their life cycle, from the startup companies to the large technology companies. And kind of in our areas, we focus on a number of different things as they relate to privacy and data security. That could be the emerging technologies, whether that be the Internet of Things or the connected cells, wearables, cloud, all of those types of things. We can create a number of privacy issues. But also on, when people get in trouble, whether that's in government enforcement or litigation, and areas where there are cyber attacks or breaches, which is becoming much more common nowadays. And so I think, my practice is I work a lot with healthcare companies, and especially on healthcare regulatory matters, working with companies figuring out how they track their data, how they use their data, really trying to help companies unlock the value of their healthcare data, both in a way that's going to allow them to achieve business goals, but also at the same time to do it in a responsible way and in compliance with applicable laws. So it's a little bit of my background, but we have kind of a good team here for the panel. I'm going to allow each one of them to introduce themselves, talk a little bit about their work, and then we're going to get right into kind of talking about how these issues are coming up in each one of our practices and our fields. So we start with Sharon.
Thank you, Scott and Ashley. My name is Sharon. I'm the Executive Director of YTH, or Youth Health. The reason why I'm here on this last panel today is because my organization, for the last 15 years, has been using new media technology to reach youth around youth health and wellness, and we adopt a very youth-centered health design to be able to do that. Over the last 15 years, we've observed the growth of technology and its adoption amongst young people. They have been early adopters of technology, and they are robust users of technology as of today. I would say more than 2/3 of them have access to more than one device at any point in time. You can't hear me? Yeah, sorry. More than 2/3 of them have access to more than one device at a point in time. They have access to social media platforms and messaging platforms. They are accessing games and mobile apps. And within this whole context, the issues of privacy and online security have become even more relevant than they were previously. So today I'll probably be talking about two main things. One is that as mobile phones are becoming more popular ways to reach our communities with information, resources, and services, a lot of community-based organizations, other entities are integrating mobile health and mobile phones into their programs. And as they're doing it, it's really important for us to address some privacy and ethics concerns, as they tend to work with developers and engineers, and they might not have enough information to be able to guide that process in terms of data security. So with support from Vodafone Americas Foundation, we developed what we call a little cheat sheet that new program managers and other leaders out there in the field who are encroaching this area can use as a starting point for conversations with the developers. And I'll briefly show that to you. So I think the main thing to talk about with the developer as you are trying to establish new programs is treating other people's data as if it was your own. So what would you be comfortable sharing? And if you feel that whatever data you're collecting, you are yourself not comfortable with sharing, it's probably not a good idea to be asking to collect that information. Collect the data that you need to make your app or your intervention relevant, and for that you might need a whole lot of data, or you might not need that much data. So at the front end, deciding what kind of data do you want and how much of it is relevant to really create the impact that you're trying to achieve through your programs. Don't steal code, a very basic thing. And I do realize that I'm talking to the choir here, and a lot of you are advanced users of technology probably. But when we go outside entities or contexts such as this, we realize that a lot of people are not really aware or educated about these basic fundamentals of treating data. So if individuals are using third-party to access information, if they are using open APIs, it is really, really important to go through the terms of services of those APIs and software before you start integrating your programs with them. Do no harm, it's a very, very basic concept, especially when you're dealing with vulnerable populations, which could be youth of color, LGBTQ individuals, etc. So when we collect that data, some of which might be sensitive and confidential, it's really important to understand that we should not be agile and iterative. Today you might have designed the program and the data is relevant today, but tomorrow it might change. So having a constant feedback mechanism from the community to make sure that the data that you're collecting continues to be relevant, and if it is not relevant, be open to changing the data that you're collecting. Increase data, reduce data, or change the type of data you're collecting. Be transparent with users. They won't have a problem with what you're doing till they do, and when they do, they will need justification for what you're doing with their data. So have a really robust privacy policy already established before you start your program. And Scott mentioned about the legal work that they do around cybersecurity and online privacy. So a lot of organizations don't have access to legal support, but there are lots of entities that exist out there that can provide pro bono support in developing a privacy policy for you. And on a regular basis, try to make sure that you're sharing information about what you're doing with the data that you're collecting with the users, because that makes them more comfortable and confident in the process. The other thing that we did over the last few months was based on an understanding that we had that young people were not viewing privacy the same way as adults do. Online social interaction, which is visible, which is searchable, which is easily spreadable, and this whole context a lot of times has been described as what we call network publics. And within this context, we recognize that young people view privacy very differently than adults. They are more concerned with social privacy and how it plays out on their online social context. as opposed to what we adults are concerned with, which is information privacy. What's happening with the data? Is it being mined? Is it being utilized for purposes that we don't want? Are we being exposed? Is our data being exposed to outcomes that we are really not aware of or we don't agree with? And that has formed the basis of a lot of work that we are doing with young people, and is also sort of guiding the new interventions that we are developing for the next, well, several years to come. And I will talk more about that in our forthcoming dialogue. So I think I'm going to stop talking there and pass it on to the folks. Thank
Great,
you.
thanks, Sharon.
Hi, I'm Betty Hong. I'm the Managing Director for Zero Divide, a social impact consulting firm that leverages technology for nonprofits, philanthropic organizations, as well as hospital health system entities. And we come into, our value really is to translate and be the kind of broker between communities that are underserved, because our mission is really driven by decreasing health disparities. So we work in heavy collaborations with technologists that want to do social good, and then doing interventions with government sponsors to really look at what matters for underserved populations. And I want to take a moment to talk about underserved populations because they're different than we all that have access to healthy incomes, education, and places to live that are safe, and pretty much have clean water and environments that help us. With underserved communities, there's language issues, there's health literacy issues, there's digital literacy issues. Even though with the young, they do social media and they're pretty tech savvy, but with elderly, third generations, older, it's going to really be a hard thing for them to take on text messaging, portals, simple things that we do in terms of interacting with technologists. So I want to take a moment to think about that because it's a really different and a harder to reach population. So that's why the government is looking at clear ways to do things that which are focusing on HHS, which is really with ACA being a big driver in terms of incentivizing technology, but technology that connects different entities, social service providers, primary care providers, and tertiary providers. So I'd just like to take a moment to see how many people in the audience are physicians. We have like 2. How many are entrepreneurs? Okay, and then anybody from like the safety net or health systems? Okay, so then I think that, we're looking at smaller organizations, but really my point is in terms of my issues and what I think are the drivers are really about, the key drivers are ACA, because it's an incentive driver for the health system. And then 2 is mobile, obviously, with 40,000 healthcare apps and different kinds of clinical devices and wearables. So what I'm going to be talking about today is to give you the top risks. What are they? What are some of the things that you can mitigate the risks are, whether you're small or large. And then also, just in terms of looking at, it's really about the patient and their reputation too, not only the organization. Because once you lose that trust because you've leaked their data out, that's going to be an issue for them to stay with you in terms of your technology or your health plan or your physician practice. Thank you.
Hi everyone. I'll keep this short so we can get to the conversation. But I'm Nicole Ozer. I'm the Technology and Civil Liberties Policy Director for the ACLU here in California. I lead our statewide team of lawyers and lobbyists and organizers and communications staff who work entirely on the intersection of privacy, free speech, and technology. Why I'm here today, I actually have 2 sisters who are academics and researchers who do adolescent health. And increasingly over the past 2 years, they have started asking me lots of questions as their interventions have increasingly utilized technology, as sort of the gamification of interventions have happened. Increasingly, they've been asking me questions about privacy and free speech issues. And that started to get me more involved with YTH and others who were sort of engaging more in the health space. And so really just a couple of things that I want to highlight before we get into the conversation is just really I'm here to talk about the things that I talk about with my sisters, which is to really sort of give people a sense of what the data ecosystem is, how information is flowing, and the kinds of ways that we can build tech tools for healthcare that are really mindful of privacy and make sure that we're not harming the people that we're actually trying to help. And the first thing I wanted to do was really just highlight, there was a recent Pew study that came out that sort of really talks about the level of sensitivity that people have about health information. I'm sure everyone in this room knows that people find health information incredibly sensitive. I thought if you weren't aware of this Pew study, you'd be interested to know that it recently polled just in the last couple of months with 82% feeling that health information was sensitive or very sensitive right under Social Security numbers. So you can sort of see the research there. We can go to the next slide. Oh, I have it. Go technology. All right. And then also as sort of we're moving into health information flowing through text messages or apps or other types of interaction, sort of the level of concern and mistrust related to new technologies. You sort of see using a landline being sort of the highest sense of security, and then down the line in terms of mobile and internet messaging and chat messages. So just give people a sense of kind of where the American public is on some of these issues. And I think that we have this high level of concern and mistrust for good reason. We've got a digital ecosystem that's really grown in the past decade or so. Information, the capacity for information to flow and be collected and retained and used in much more complex ways. And that the information can be flowing to a lot of people. Some very for good, like researchers, but also flowing to third-party companies, to data brokers. And in the mobile space, it's a very complicated ecosystem. We got a lot of players. We potentially have, providers, we have apps, we have analytic companies. So data can be flowing in a lot of different ways, wittingly or unwittingly, by those of us who are building the tools and building the infrastructure for this collection and use and retention. So I think that level of concern is very valid because there's a really complex ecosystem that's been developed, and the law has, as we like to say, is really stuck in the digital dark ages. The laws and safeguards don't necessarily match the current realities of the digital world. And that's leading to some really bad outcomes. We like to sort of highlight some of these issues that sometimes end up in Scott's world when people end up with call before Congress or government investigations or class actions or data breaches or postured on the front of the New York Times. Usually when those things happen, first the reporters call me and then they try and the companies then try and find a lawyer. But recent examples where we've really seen the public getting a sense of how personal information, particularly health and sexuality information, isn't necessarily being properly safeguarded. We had an example a couple of years ago where a teenager shopped at Target and information was sent to her home that revealed her pregnancy to her father without her ever knowing it, based on what she had bought, vitamins and a couple of things. We got a call a couple of years ago from a student at Stanford, and we got several of these calls, who had liked an LGBT group because he wanted to be involved in it on campus, just like you all might be working on interventions where you're encouraging people to engage in social networking. Because Facebook changed their privacy policy, this student was outed to his small southern town. So this has real ramifications on people potentially trusting interaction with organizations and interventions. We had a father whose daughter was killed in a car crash, and he got a letter from Office Max addressed to daughter killed in a car crash or current business. I mean, these are like really unfortunate situations. And it came out last year in a congressional inquiry that data brokers were selling information about rape victims, people with HIV/AIDS, people who suffer from alcoholism and erectile dysfunction for less than 8 cents a name. So these are sort of real issues that we've seen coming out about health information and sexuality, not to mention all of the data breaches that have been happening, and of course, all of the government demands coming in terms of surveillance going into major companies. That's become much more transparent post the Snowden revelations. So that's what I'm here to talk about. I'm always such a downer in these things. But the positive is that the ACLU, we have guidance on some of these issues. I'll talk about some of that some more, but we have a primer. I have some postcards in the front that really sort of bring people through the big questions to ask and to ask and answer as you're developing some of these tools and business models and technologies. And we'll talk more about that on this panel. So thank you.
Great, thanks Nicole, and thanks everybody. That was really interesting. And I think one of the themes I think in each one of your initial comments, I think the industry struggles with in general is what expectation of privacy do individuals have when they are using mobile apps, especially when they're using healthcare mobile apps. It may be that folks have come to grips in terms of how information flows when they are using Amazon or using some other consumer-oriented shopping websites. But now, because we are taking the infrastructure that we have and the technology to be able to, that we're using in the consumer space and applying that into the healthcare arena, now all of healthcare information is being disseminated in very similar ways. And so I think, Sharon, you initially pointed out that there is a different expectation of privacy perhaps with respect to children and young adults than there is with older generations. I think we've seen that in my practice that play out for sure, and then we've also seen that on a geographical level. In the EU, for example, there is a fundamental right to privacy. So they think of it as their constitutional right akin to freedom of speech, which I think in the United States is probably not seen at that level.
Except California.
Except California. And so, I think especially as we are trying to be leaders in the space and trying to roll out new products and new services, how do we kind of manage those different expectations? And because we can only develop kind of one product, one service that's designed to suit everybody's needs, and so it's hard to tailor something that's to a specific demographic if that demographic seems like they treat privacy and think of privacy and data security differently. So how do you, and in your experience, how do you try to manage across those different expectations, and how can we, what can we take from that to build our products, build our services, and be responsible users of those products and services?
Absolutely. Scott, thank you. As Nicole said, we might still be living the dark ages of digital innovation. And yes, these rules are being written and these conversations are happening. And I have full confidence that these guidelines will continue to evolve in terms of protecting our communities. But as Scott, you were saying, depending on the demographic, geographic nature of our audience, the issues and definitions of privacy that differ, and how they approach privacy also differs. My work at my organization is predominantly with youth and young adults. So from our end as providers, there are certain best practices around data that we have to employ. And those have evolved over the last 10, 15 years. I remember, I think we were founded around 15 years ago, and initially HIPAA, the way it was written, it was very difficult to sort of adapt and tailor it to all the new innovations and technologies that are coming out, but that's become much better now, obviously. But there are some best practices that we absolutely have to employ as providers, protecting the data, doing no harm that I mentioned earlier on, ensuring that we have a solid privacy policy on any product that we create. Also ensuring that a lot of times we don't have the ability to generate our own databases. So a lot of times we're looking at open APIs and third-party providers for that database to run our app or our online web browser app or whatever it might be. In those cases, making sure that we and our legal team goes through their terms of service really deeply to ensure that we are protecting the data that we are making available and also collecting from our audience. Within this whole context, I think going back to the privacy issues, When you look at age, we realize that younger individuals are more concerned about their social reputation and hence within the social context what information and data they share. As these individuals get older, their belief and literacy becomes more sophisticated and they start exploring and paying attention to the commercial data mining and what they're putting out there and how it's being used. So that is a shift that happens, and as providers we need to be aware of that shift and respond to it as we're designing these programs. Gender. Boys tend to feel less at personal risk than girls for many, many reasons. And so girls tend to be more safety conscious and they tend to feel more vulnerable to these risks. What we also realize is that there is this whole context and practice of public by default and private by effort. Because young people, they don't view privacy as a yes or no. It's a continue for them, and they are constantly exploring the risk benefits of everything that they share. And depending on the social context of how they're engaging and interacting on online technology, they may decide to share something today on a certain context, and they may not decide to do it in another context. So it's a constant conversation that happens, and as providers, I think it is our responsibility to keep our fingers on the pulse of our communities and respond in a more evidence-based, educated manner.
So yeah, I think that those are really important points, and I'd be curious on Nicole and Betty and your views on this, and maybe with a, an additional kind of thought to add. One of the tricky things about this is that if everyone doesn't come at it from the same perspective in terms of what their expectations are, it's almost left to the app developers to set expectations as to how their information can be used and how it can be disclosed and what information is going to be collected, which can present. And so I think that goes to your note about the privacy policy. And I've developed many privacy policies over the course of my career, and I can tell you that they are written very much from a legalistic point of view because they are designed to protect the company. Because the way that you can get in trouble under a privacy policy is if you say something and then you do the opposite. You say things and you don't actually comply with those. Right. That's where you get the legal the liability. And so when you're developing your privacy policies, you're always thinking about how do I carve out the largest amount of uses and how can I protect myself in this document, which I think most people think no one ever reads that anyway. And then throw on that where you have that kind of perspective, and then try to throw on a 15-page privacy policy that's supposed to be read over a phone of 4 inches. And so that's a real challenge, I think, that's really presented in this community. So I'd be curious in kind of what your views are on how folks who are having to deal with this difficulty are addressing those issues, and how we would recommend that they work.
So I just want to share with you all that I come from a kind of a diverse background, working as a CEO for a community health clinic, and as well as working in enterprise, Kaiser Permanente, Blue Shield, and Cigna, in terms of risk management and information security. So that gives me a different perspective, but what I wanted to share with you today, if there's 2 things that I do share with you, in terms of when you're creating an app or you're looking at sharing data between different entities, the huge element of the risk management foray is 2 things, the in and out. So if the highest risk is that you're utilizing different people to do the work that are not your employees, where you have control, a lot of vendors, that's your highest risk. So if you can really do 2 things, look at your risk analysis, take the time to be really deliberate and think about the risks, how much you're going to invest in it, to mitigate it, and then create key things. Look at high, medium, and low. Look at the in and out, whether it's really the people, it's not the systems, because the systems can be hacked anyway, in which way. It's really the people. So, in terms of risk, the risks are lost and stolen devices, and then next comes in terms of activists, and then third, sharing files. So if you think about those things and just focus on those, you probably hit most of your risks in your environments. When you consider tips for me to give to you is really, when you look at the risk analysis, categorize it, you think about what other people are doing in your environments, what are your comrades in the same field of entrepreneurship or safety net, then that would be a good kind of benchmark. The other thing is looking at, if you're a researcher, it's impossible, you're going to collaborate. So you need to encrypt your data going out and going in. That's just like basic risk management. Anthem had 80 million people. They didn't encrypt their data. That's a basic thing, and it's not, and it's cost effective. So you do that already. You have strong passwords. You create inactivity timeout. You segregate the duties of those that manage your EPHI. If you segregate it, you have more control. If you can't, then if everybody's using mobile, then create configurations that are security and on your mobile devices that are your organization devices. If they're going to BYOD, then have them sign an agreement that they're going to control the security or use your security controls. Those are basics. And so if you can do those things, and then also in terms of texting, we are involved with texting. If you're going to be an the risk on a kind of a simplified manner instead of getting to the paralysis analysis of what you have to pay for. Just think about the work, who you're working with, and those are the things that I would do if I was a private practice, if I was an entrepreneur. And then if you want to think about how do you test your risk, I would even go as far as hiring a hacker to see if they can go into your system. And then that would be like the best way, because there are people who do it really well, and you probably don't have that kind of mindset.
So there are obviously a lot of basics of security that a lot of folks are not necessarily doing as well as they should. And so that's sort of low-hanging fruit that everyone should be thinking about. But also, remember to be thinking about the big picture of what you're trying to achieve with this app or with this system or with this intervention. If you really want people to trust it, to use it, to feel safe sending really sensitive information about their situation or their health care or their concerns, then collecting all the data you possibly can, retaining it forever, and sharing it with a lot of people may not actually be a very good cost-benefit analysis, because people may not want to use it. So it becomes a very expensive, totally ineffectual, maybe secure, but not usable system. And so those are some of the things that we really talk about in the primer, that, really pushing back to be designing systems with the developers and thinking about privacy policies and other safeguards and things that make sense for what you're actually trying to achieve in the big picture. And I think that a lot of that can sometimes go missing when people are only focusing on the security and the data breach, and they're not thinking about the design and baking in privacy safeguards from all through the development process. And there's just like really basic things that people just do not do. Like, it really sort of shocks me sometimes. It's like using third-party analytics to track in your sort of intervention in terms of efficacy. That's a third-party company that data is pulling out. Like, don't do that, please. That's not a good idea.
I think those are really important points. Sharon, I'd be curious in your thoughts on especially on the development piece, in terms of what things that people should be considering, developers should be considering kind of during their development process. And then one other thing I'd be curious on each of your perspectives is, I think Nicole, you provided a very helpful chart which showed kind of the data ecosystem, which I could not agree with more in terms of how data can flow. I think especially in the healthcare situations where I think that chart shows a lot of how data flows on the consumer side, and then even on the health side, it flows probably even more than that, because there are established methods by which healthcare information would flow, and quite appropriately, from a provider to the patient, provider to the pharmacy, pharmacy to the PBM, to the insurers, to any number of the people who all kind of fall within the health ecosystem, which can also be just as complicated as doing any other type of data analytics. And our question now is, do people really understand that when they're using mobile devices? And so how can we think of these two things? How do we, one, think about the idea that app developers should be thinking about privacy in connection with their development? And then second, how do we kind of think about how data should flow to third parties and how we should potentially think about restricting that and using it appropriately?
Absolutely, thanks, Scott. So, the work that we do, we have very quickly realized that there's this part of the equation, the developers, the engineers, the software guys, and they speak a different language. And then there's the community providers, front-end case managers, doctors, clinicians, and they speak a different language. And now technology is bringing these two worlds together, but there is a huge divide in terms of digital literacy. So for example, if a doctor or a case manager wants to develop a mobile phone app and works with developers, they currently, very few of them, have the information, the know-how, the knowledge, or access to that knowledge to be able to have an educated conversation with the developer and be able to drive that whole train. Currently, depending on who the developer is and what we know most developers have their pet projects. They like to usually do things in a very certain way. But these community providers don't have that information, don't know how to drive a train. And that can create a situation where you don't know what's happening with your data. You're totally depending on a developer. So digital literacy, I think there's a huge gap there. There's a huge need for it. And there are some players that are jumping into to fill that gap, but we still have a long way to go. In terms of data, I think as we are designing our programs, what we do is we look at how the data is going to flow from our client, patient, youth, community member, all the way to the provider and back. And then we look at each touch point and different entities that will be exposed to that data. And if we feel at any point of time that this entity, we don't have a privacy policy with them, we don't trust them or something, we will make sure either not to let that data flow, or we'll make sure that we have a level of encryption that the data cannot be mined or extracted from that flow. To give you an example, we have a medication adherence system, and to your point, Nicole, around HIV and you too, Betty. So obviously, medication adherence reminders. You have to send information to your clients to tell them that it's time to give them the reminder for taking the medication. So we have built in like a really robust platform and encrypted database that makes sure that even if I want to access that database, I have to go through 15 different groups to be able to access the data. Even when I access the data, at no point of time do I get data that I can link personally identifying information with a diagnosis or with a message. Everything is separated. So even if the system gets hacked, there's no way that an individual will be able to link it to a diagnosis or to a specific message. And those are certain best practices, right? In terms of the actual content that we create that gets disseminated to our audience, we ensure that at no point of time any information or message goes out that indicates, even to a very minimum degree, the diagnostic or therapeutic status of that client or that community person. For example, in the medication adherence reminders, there's no HIV in the messages. There's no AIDS in the message. There's a very basic boilerplate information. It is time to take a meds. And we allow our users to go in and say, well, actually, I don't want this message. I want to change it and make it even more diffuse. And there are some people who have actually written messages that say, it's time to have my daily strawberry. Things like that. So just some best practices, being aware, being educated. I think that's really a critical point. And to reinforce my point on digital literacy, it will organically happen over a period of time, but I think we need to accelerate that.
Excellent. And Betty, maybe you can kind of answer the same question about development, but maybe from a slightly different perspective. Are there specific concerns or specific issues that people should be thinking about when they're rolling out apps to underserved populations who may not have the digital literacy that Sharon had mentioned, may not even have even more of the basics? And so, what types of kind of best practices have you seen in that area that may kind of inform us, at least in working in that group, and then maybe we can kind of pull on those best practices to work with other communities as well.
Yes, I think with underserved communities, it's really about, first it's about health literacy and why are you doing it, then what's the benefit? What is your app or your platform going to benefit for them? So you do have to show that really quickly, like you would with anybody. But when you're thinking about language, it really has to be at a lower level, education level, like 4th grade, 5th grade English, so that it could be absorbed and accessed. A lot of times when we're working with and looking at other technologists that want to do social good, they're creating icons and visualization, not text, so that it's easy to understand and easy to take the plugins. So that's really important in terms of, and especially with elderly, you have to make it non-complex. If you're looking at that market, diabetes, other kinds of focused areas. The other thing I think with apps and as we get more mature in their digital maturity level is really, like I said, if you can segregate the opportunities with who are your developers and doing that work when they're handling the EPHI. At Kaiser, what we used to do is when we had to do some things for corrections or IT management for sustaining different legacy processes, they would go live with the data, but they would have it de-identified, and then in that period of time when they work through a project de-identified, then you can't identify it with the patient. So that helps mitigate, and so as much as you do that and you document it, then the security is there, and so you won't be fined. At least you did some minimum levels of the security rule.
Excellent, thank you.
I think, I do privacy and free speech and technology at the ACLU, but the ACLU works on a wide range of issues, on substantive issues where we're working with vulnerable populations, whether it's on immigration, whether it's on racial justice, whether it's on economic equality. And we too as an organization are trying to use technology in innovative ways to connect and communicate and mobilize people. And so one of the things that we've been doing in the last couple of years is actually helping the rest of the organization to be building these kinds of tools in ways that are consistent with privacy. And we recently released a mobile app for policing issues, which some of you may have seen. It's mobile app for justice, where people can record the police and interactions with the police. We've done similar things in the immigration context. And we really had to think very, very closely about, of course, the data collection. And on the Pew study, one of the other pieces of data that people find very, very sensitive is location information. And that's one thing that we find a lot of app developers, in the absence of guidance, will default to collecting location information all the time and retaining it forever. And so that's an issue that people should definitely think about when they're developing some of these materials, and is included in some of these tips for app developers. But all through the data ecosystem, is it going through different systems? What are you collecting? How long are you retaining it? What are you using it for? How are you evaluating, and what kind of analytics you're using? Because all of these can be the difference between people being able to use it in a trustworthy way versus you ending up between your clients and the government or a third party or the police. It can be a really bad scene, and of course, we don't want the ACLU plastered on the front of the New York Times, for issues related to privacy of our own apps. That would be very embarrassing.
So that's very helpful. I mean, so Nicole, I think one thing that you referenced during your introduction, and kind of that's also the background of what we're talking about today, is you had mentioned that kind of privacy from a legal point of view, from a law point of view, is still in the digital dark ages. I think that was what you mentioned. And from in the United States at least, we have a number of different regulatory ways by which privacy is regulated. I think the backdrop to at least most of the healthcare data is HIPAA. But HIPAA, of course, only really applies to the extent that you are a healthcare provider or a plan, or you are a service provider to one of those. In the mobile space, a lot of those companies are working in direct-to-consumer manner. And so they are working on providing services directly to the consumer, in which case you're not doing anything on behalf of a plan, you're not doing anything on behalf of a provider, and so HIPAA does not really apply and doesn't protect any of that information that is being collected. The same information can be just as sensitive. So people can disclose their HIV status into an app, which and then HIPAA would not potentially apply to that if they disclose it themselves, versus if a doctor were to disclose that information to the app, then it would apply.
Right.
So it's the same information regulated two different ways. And that's kind of a function of the way that we have at least in the United States. And then we have a kind of a hodgepodge of other state laws that potentially could apply in an interaction between all of this. And so Nicole, maybe I can start with you. What, if that's our current system, and I assume that that's not something that you believe is kind of is caught up to speed in terms of the way technology works, what would we think that is a better solution to that? Or if we, in the absence of kind of any legislative action, what should industry be thinking about in terms of either self-regulatory measures or other types of codes of conduct or things like that?
Well, there's a lot of movement afoot, obviously, in Congress and in state legislatures on these issues. The Consumer Privacy Bill of Rights has been introduced in Congress. It would actually apply not just to companies, but also to nonprofits. So there is some sort of movement in terms of creating some slightly more comprehensive sort of baseline for privacy, so it's not left to the app developers who don't necessarily really know sort of the right things to do in this space. There's also a lot of state legislation, and here in California is probably the most active place for this. There's upwards of 60 bills related to privacy currently moving through the California legislature. But really, at this point, good privacy has to be more than compliance, because people's expectations of privacy are not fulfilled by just complying with the current regulatory regime. People don't like surprises. They don't want to find out, as Sharon said, later on that their information ended up being used or shared in a way that they hadn't anticipated, even if you had it in your 15-page privacy policy. So I think that the Federal Trade Commission has obviously done some good work in sort of laying out some baselines for these things in their privacy reports that have come out recently. The California Attorney General has also set out best practices in the mobile app ecosystem that if folks aren't aware of, they really should, because it's not just the Federal Trade Commission, it's also the state attorneys general that are certainly looking into privacy. And then there are sort of basic privacy and security steps that we outlined, that Sharon has in some materials, and some of these others have as well, to really be thinking aggressively and proactively about how to safeguard privacy. Because we believe that if you're building it in, you're going to have a better outcome in the end, and I won't have to respond to the New York Times about something that happens in your company or organization. I don't always enjoy doing it, but I'll do it if I have to.
So I don't know if you guys have anything to add to Nicole. I know we have about 5 minutes or 7 minutes left, so I want to leave time for questions from the audience. I think one of the things that is unusual, at least the way that we regulate data here in the United States, is that data can be regulated differently depending on the type of data. And so, in the EU or in countries outside the United States, they have a much more comprehensive set of regulations that would apply to all the different types of data. And so I think, Sharon, in one of your introductions, you indicated that the sensitivity of the data could make a difference in how we want to use it and disclose it. So I think that kind of thing could potentially inform regulators and policymakers as they're thinking about these goals.
I think something that really resonated with me was what Nicole said, which is complying to certain rules and guidelines. That's one part, but I think as community providers, as people who are responsible to the vulnerable population that we serve, we have to hold ourselves to a higher standard. Compliance is not enough. Protecting our community, protecting the information is what we should be aiming for. And how does that play out in real life? So I wish that we all had enough resources that we could go out and have a huge campaign around digital literacy, working with developers, software engineers, as well as training providers, but we don't. So what we do in our small way is model that behavior. We do a lot of trainings and capacity building assistance to organizations around the country, and so we design these programs, we share these programs, and a very key component of that sharing is how we are protecting our communities, how we are ensuring that the data is confidential, stays private, because these are vulnerable populations, and sometimes the information we collect is sensitive and it needs to be protected. The other part that I was totally clicked on the second point.
I'm sure the audience is going to remind us.
Yes, I'm
We'll
going
go
to, let's
questions.
probably go to questions.
Betty, anything else, or we jump right into the Q&A?
No, I just think it's kind of looking at the two high risk are people, the work you do with the people, and then the vendors. Because the vendors, you have vendor agreements, and you have comprehensive lawyers looking at that end to end, but it's really about training your staff, having communications, maybe mandatory training about privacy and security. Make it fun, having incentives, quizzing. You can do it. It's not that impossible, and it's something that is has to be integrated in terms of your whole management and strategic direction.
Great. Any questions? Okay, go ahead.
My question is about integration. So, we're moving into a world where apps and companies are developing products that want to be integrated into, say, EHR or EMR in the future, or there's a lot of EMRs coming out. How do you deal with security and privacy as we are just entering the phase of integration from interoperability, those questions of being able to have information all across the health system, so wherever you go. So I guess it's coming from, we have all these people who produce apps that will help, monitor or educate patients or, provide some type of service, but that information somehow needs to get somewhere eventually. And that integration hasn't happened yet. So I guess from that, perspective, what do you guys see? About policy there.
So I've seen that issue come up in my practice quite a bit, and I can tell you there's a number of legal issues that come along, especially as you integrate with EMRs or integrate directly with hospital systems. And so all of those hoops need to be jumped through, because again, the HIPAA becomes more of an issue for you in terms of how you have to system to develop methods by which you can pass, pull and push data back and forth, and what types of safeguards and privacy programs that you're being put into place to protect that information, which could be data that you are making sure that at least you're hitting the minimum standards that are set up by the rule, but a lot of vendors especially want to go beyond that, especially in the data integrity portion, because to the extent to which you're pushing data that goes into an EMR that may affect the doctor's treatment of a particular patient, the more important that data actually is valid and is not something that is either corrupted or incomplete or something that's going to actually result in a potential malpractice claim or affect patient care.
I think it's a huge issue. The Office of National Coordination, ONC, is grappling with it too, because they want data to be shared, in terms of social determinants, right? We have population health managers, social service providers, and the primary care providers. They're on different systems, right? So I think it's really places that innovation and open source is in Chicago, not here. And it's because they have a champion there. So it's a little different. I think that we should look at those places and try to engage and provide that support, but it's going to be a policy issue in my mind.
Great, I think we have